Thank you so much for joining us today. We appreciate each and every one of you for sharing a part of your day with us and supporting us as we celebrate the opening of two very special programs. I'm Rachel Master, the clinical liaison for Odyssey Outpatient Network Nashville, which is made up of Pasadena Villa and Selah House Nashville. Odyssey Behavioral Healthcare saw a need for high quality mental health and eating disorder step-down options in Nashville. So we decided to extend the amazing work being done at our residential centers to our headquarters city of Nashville. Pasadena Villa specializes in treating adults struggling with behavioral health and co-occurring conditions. There's our slide. And Selah House specializes in treating eating disorder diagnoses. Both programs offer PHP, IOP, and virtual IOP options for adults 18 and up, and we treat all genders. PHP programming is offered Monday through Friday from 9 a.m. to 3 p.m. IOP programming is offered 3 to 5 days per week from 9 a.m. to 12 p.m. We strive to offer customized treatment plans, compassionate care, and a collaborative environment where we see our community partners, such as yourselves, as an extension of our team. We believe this team approach offers our clients the best opportunity to find long-term recovery. Both programs are located at 2900 Vanderbilt Place. We're right across from Vanderbilt's football stadium, making this an extremely convenient location in Nashville. So once we remove these PowerPoint slides, you'll see that our team all have this similar background as me with our logos on it. That way you can tell our team members apart. And a couple housekeeping items before we start. So we encourage everyone to change your speaker view or change your view to speaker view by clicking the upper right-hand corner of your screen, press view, and then change to speaker view so it highlights the person talking. We also ask that you kindly mute your speakers during the presentation. I think everyone's muted. We're gonna offer Q&A session at the end, so you'll be able to unmute yourself then. And as Kayla said, please, we encourage you using the chat function to put any questions that might come up, and then also put your name and contact information in there. And we have Ileana here who will be watching that chat to make sure we get all your questions answered towards the end. So a quick rundown of how we're going to spend our time today. So we're going to first hear from a couple of Odyssey Behavioral Healthcare's leadership team members. We'll then show you a virtual tour, followed by a showing of our ribbon cutting ceremony. And then we'll introduce our team members. And lastly, we'll allow time for a Q&A with our staff. So with that, I would like to hand it over to Richard Clark, Chief Executive Officer of Odyssey Behavioral Healthcare.
Hey, Rachel, can you hear me okay?
Yes.
Hey, well, I'd like to welcome everyone to this virtual opening of our Pasadena Villa Nashville outpatient clinic. It's great to have such a large participation here today. I just want to thank Rachel, Kayla, and Robin, especially for pulling this together today, and Rachel for leading this presentation on behalf of Pasadena Villa Outpatient and Odyssey. Just would like to share with everyone, this is a very important development for our company, and under Robin's leadership and others, we've seen its opening, and we're very excited about where we are today in Nashville. This is one of several outpatient programs we have opened recently. We have additional programs that we are opening the latter part of this year into next year. And again, we're very excited about this opening, and it's a great part of our outpatient vertical here at Odyssey. And I would just like to thank everyone for joining, and I'll hand it back to you, Rachel.
Thank you so much, Richard. We're really grateful for your leadership at Odyssey and thankful that you could join us today. Okay. So next, I'd like to turn it over to David Bell, Vice President of Outpatient Services at Odyssey Behavioral Healthcare.
Thanks, Rachel. I just want to echo your and Richard's comments. Welcome everyone to the virtual open house. I do want to congratulate Robin and her staff. It's no small task finishing up all the efforts that go into opening a new center. And I want to thank all those folks who have been involved in bringing these needed services online. Richard mentioned it a little bit, but Nashville is really a key continuation of the growth of the Odyssey Outpatient Network. We currently operate centers in North Carolina, Virginia, Ohio, Indiana, California, and now Tennessee. And as he mentioned, we are going to be expanding our locations and offerings in Virginia and Ohio next year, as well as Tennessee, and opening new developments in California next year. So it's definitely a time of growth. And that growth is specifically to meet the demand for outpatient services, especially at the partial and IOP level. We find demand not only in our existing markets, but also the markets that we've identified for development. So we're very excited to meet that need. I did want to mention briefly, one of the items was that we are going to be in network, or we're working to become in network with Blue Cross Blue Shield of Tennessee. In addition to Blue Cross Blue Shield of Tennessee, we are working with Aetna, Cigna, Beacon, Magellan, and Humana, and have had communications with all of those folks. And I'm sure folks will be getting updates throughout the fall with notices of becoming in network with all of those providers. So we're excited about that. But I do want to stress to everyone on the line that we are able to work with everyone's out of network insurance, and eliminate or reduce as much of the financial barriers to treatment that we can within the Nashville area. So again, congratulations. Thank you for all your hard work. Thanks, Kayla and Rachel, for making this virtual open house a reality, and I'll turn it back to you.
Thank you so much, David. And thanks for giving us an update on insurance. I know we're all excited to become in network. And like you said, our admissions team has been awesome and trying to help people and work with them financially. And you've been vital to the opening of this program, and also just the growth and accessibility to outpatient services across the country. So thank you so much, David. So next, I am extremely excited to share our virtual tour of our space. A few notes before I play the video. For those of you who have actually seen our space in person, know that the windows all the way around the building and the beautiful trees showing through make our space a really peaceful environment. And we were intentional about making the space as comfortable as possible for our clients, including seating for all sized bodies. Also, be sure to look out for our newest addition, our hand-painted wall mural that brings the outside trees in a fun and uplifting way, while also symbolizing growth and recovery. So with that, here's our tour. I love that video. I might be biased. All right, so here now is, this is our team at our ribbon cutting ceremony that we held 2 weeks ago. And Karen from Nashville's Chamber of Commerce helped us with this ceremony. Thank you, Karen. I think she's here. It was a really special day, and I really wish we could have shared it with all of you in person, but there's our team. We're all smiling underneath our masks. So now we can just hold off on this for a second, Kayla. Let's exit out of the PowerPoint because I'd like to introduce you to our team members. So first, we have Robin Morgan, our executive director. So Robin Morgan comes to the Nashville Outpatient Center with a varied professional background as a behavioral health clinician working in outpatient, inpatient, and emergency department settings with a variety of populations, and a leader in behavioral health operations and nonprofit management. Most recently, she served as Director of Clinical Integration at Trust Point Hospital, where she oversaw the growth of multiple departments through a significant facility expansion. She is also active in the community, currently serving as the co-chair of the Mental Health Vision Council of the United Way of Rutherford and Cannon counties. She relocated to Tennessee in 2014 from Boston, Massachusetts, where she worked as a psychotherapist for the Center for Infectious Diseases at Boston Medical Center, providing counseling to individuals from adolescents to seniors living with HIV. She completed her Master of Social Work at Boston University, where she received the Herbert S. Streen Memorial Prize for Excellence in Clinical Practice. Prior to completing her MSW, she worked for more than a decade in nonprofit management and fundraising, including serving as interim executive director for the Family to Family Project, an organization working to prevent and reverse family homelessness. In addition to her MSW, she earned a Bachelor of Arts, Phi Beta Kappa from Johns Hopkins University in anthropology and a Master of Arts in ethnomusicology from the University of Maryland, College Park. Wow, Robin, we're so excited to be open and accepting clients. Can you tell us about your role as executive director of our programs at Nashville Outpatient and the core values of our programs?
Absolutely. Thank you so much, Rachel. That was a mouthful. Well, welcome everyone. It's so great to see wonderful clinicians and partners that we've already started working with on our virtual open house this afternoon. Appreciate your time. We're really thrilled that our center is open and we're accepting clients to both our Pasadena Villa and Selah House Outpatient programs. I know, as others have said, there's such a growing need for behavioral health and eating disorder treatment here locally in Middle Tennessee and across the country. And so I'm really excited that we can help address that need, particularly since the COVID pandemic, social isolation, more individuals are struggling and we're here to help. So in my role as executive director, I feel like I'm honored to have the position to lead our wonderful clinical and administrative staff. They come to our program with varied backgrounds and expertise, and we really look to draw on those strengths in our programming and also support our staff's development so that they can expand their training and certification and expand what we can offer our clients. So we really are both client and clinician staff centered, supporting both. Our core values, we seek to work with our clients regardless of our role from a position of respect and compassion. We meet our clients where they are. Our staff is provided education and coaching on trauma-informed care, which I feel helps them better support our clients and each other in this treatment setting. And we're an inclusive program that celebrates diversity. As you can see from the video, our treatment environment was intentionally designed to be warm and inviting to help clients feel safe, valued, and welcome. And then you'll meet some of our clinical staff as well who go into more depth, but our clinical approach is client-centered. We utilize evidence-based modalities to meet individual needs, whether they're struggling with an eating disorder in our Selah House program or mental health diagnosis in our Pasadena Villa program. Our intimate setting and ability to do smaller groups, we can adjust programming if a specific approach is needed for a client or a group of clients. We don't provide one-size-fits-all treatment. Our primary modalities or theoretical approaches include cognitive behavioral therapy, dialectical behavioral therapy, and trauma-focused therapy, which are used in our group therapy sessions and in individual work. We supplement those approaches with expressive and narrative therapy, self-compassion work, mindfulness, and psychoeducation. We also provide nutrition counseling, medical monitoring, and psychiatric medication management as needed, based on each individual treatment plan.
Thank you so much, Robin. We're really grateful for your leadership, and I've seen it very clear how passionate you are about this work and getting the clients the best possible treatment that they can have. So thank you so much, Robin. So next we have Maddie Emler, our registered dietitian. So Maddie is a graduate of Samford University, where she completed her dietetic internship and obtained her MS in nutrition. She is passionate about helping individuals find what works best for them and their lifestyles. She understands that each individual client has unique needs and goals. Maddie uses motivational interviewing techniques in her nutrition counseling to help empower clients to reach their goals. She also practices within the philosophies of intuitive eating and health at every size. She loves to travel, and you'll most likely catch her backpacking on the weekends. So, Maddie, tell us about our nutrition philosophies and overall nutrition programming at Selah House Nashville. You're muted. Sorry,
Thank you.
Yeah.
I always forget about that. So a part of what we do here at Selah and also at Pasadena, I do incorporate health at every size, intuitive eating philosophies into every group that we do. I try to go with the approach that all foods fit, especially too when we think about our Pasadena Villa patients. We note that nutrition has such a large impact, especially when you think about anxiety, mood, and various coping mechanisms that they may be using. So we try to bring in those components and bring an alternative, and how we, especially in experiential cooking groups, how we utilize skill sets for our Pasadena Villa patients. For particularly our Selah House patients, though, we utilize intuitive eating and the approach to address food rules, fear foods, safe foods, and so forth. We do like to challenge our patients and clients about once a week with a new challenge that they will decide on. Again, we like to always include them in their treatment and their recovery and give them the power back. So a part of that is meeting them where they're at. So we will kind of pull from a hat at the beginning of the week and be like, hey guys, this is what we're going to be doing, whether that be a cooking group or we bring in cupcakes to have for snack. So again, it gets everybody on the same page, but also they have a little bit more autonomy in their recovery process. We also utilize health at every size when we discuss in groups such as like body appreciation, kind of that, and we do tag team that, especially with our therapist. So it's been fun to kind of have the both of us in that group, especially when we think about one of our groups in particularly from earlier in the last couple of weeks, we did a gingerbread man where they were able to kind of experiment with, hey, how they felt on the outside versus inside and cut away the outer negativity or negative self-talk, which we were able to utilize in both of our Pasadena and Selah House. So we've been kind of incorporating a little bit of both into each group, but definitely trying to also give them that space and time that they specifically need for individualized care. So roughly we kind of do about 4 to 5 groups each week that are kind of more nutrition focused. And then Pasadena Villa will kind of incorporate them as we see fit for the milieu and case by case basis, especially. So each patient, when upon admission, And also depending more so for Selah House, we'll meet with their dietitian and we'll kind of come up with a pretty much like a treatment plan right off the get-go and kind of come up with a nutrition meal plan that kind of fits their needs at that moment, but kind of gearing them up more towards an intuitive eating approach. So we kind of go by based off of the My Plate and plate by plate method for more of our younger individuals that still have family members that are very active if we do need that family support. And so we kind of will work through that once a week in individual sessions for our PHP and every other week for our IOP patients. And then on the flip side for our Pasadena Villa patients, I'll probably do case by case basis. They'll meet with their nursing staff and go over the SCOFF set of questions, which is kind of a basic broad questionnaire to kind of help us screen as to, hey, the importance of nutritional care for them. We do know that every patient does need that nutritional support, but it kind of flags them a little bit more so that, hey, we give them that extra individualized care that they need. So yes, it's kind of a big melting pot, I like to call it, with both that definitely we like to combine the groups together, but also give them that separate time.
Yeah. Thank you so much, Maddie. I've been really impressed with Maddie and the programming that she's developed for Selah House, and also just the amount of nutrition that's incorporated into Pasadena Villa, because as we all know, nutrition impacts our mental health and our medications, and Maddie's really just been hands-on and done amazing with our programming. So thank you so much, Maddie.
No problem.
Yeah.
I also want to say I'm sorry that my picture is backwards. I had no idea how to get it fixed. So
no,
here we
it's
are.
good. It's good. I think. Yeah, you're good.
All right.
Thanks, Maddie.
All right. I will see you guys. Thank you.
Yeah. So next we have Lina Roberts, our primary therapist for the eating disorder program. So Lina Roberts is a licensed clinical social worker who comes to this program following a 20-year career at Vanderbilt Children's Hospital, where she specialized in adolescent and young adult health needs. She worked in inpatient and outpatient settings to meet the needs of patients and families in the Nashville and surrounding areas. She specializes in the treatment of eating disorders, anxiety, and depression through modalities that include cognitive behavioral therapy, motivational interviewing, and dialectical behavioral therapy. Prior to her work at Vanderbilt, she was the clinical therapist for group homes that worked with at-risk adolescents in the Nashville area. Lina is a native Nashvilleian who received her master's degree at Tulane University in New Orleans, Louisiana, where she began her career working at Columbia DePaul Psychiatric Hospital treating adolescents. So Lina, what therapeutic treatment modalities are we using at Selah House Nashville to treat our clients struggling with eating disorders?
Good afternoon, everyone. Yes, as Robin already mentioned, I think we do a lot of the evidence-based, which involves the trauma, CBT, DBT. We also like to do a lot of experiential. I find a lot of our clients report how to operationalize this into our day-to-day life. So I think we are really trying to take kind of the best of all of the areas and apply that, as well as appreciate that each of these clients comes with their own history. A lot of these clients have had wonderful outpatient therapists and experiences with residential stepping down, or this may be their first venue into getting into treatment. So kind of also trying to appreciate the challenges of kind of all of those put together. So working closely with the dietitian and also the primary therapist for Pasadena Villa to kind of create a milieu that is cohesive and inclusive, but also provide some individualized support within it, has been a really fun challenge to take on.
Yeah. Thank you, Lina. It's been awesome seeing you shift based on the clients that we have in program. So can you also tell us how we incorporate families into client care at Selah House Nashville?
Sure. Very early on, technically the first day, I do a pretty intensive biopsychosocial. We're kind of asking them who are their support network, which can include families, but also for some of our young adults. maybe other friends or extended family. And so kind of setting up what would be part of their crisis plan, support plan, and then kind of including that on a regular basis. So we have some clients that we are doing some pretty regular family therapy. And some of that is in person and some of that has also been via Zoom, since we are treating people who are here in college or have come to Nashville to, you know, whether it's music industry or healthcare, kind of start to establish their new adult life. So kind of including that as regular as we can, because I think we would all agree, whether you are 18, 38 or older, your parents and or family members still have some thoughts and opinions on your life. And we all spend time with them at holidays or don't, which kind of appreciating how that affects mood and behaviors, I think is an integral part. Since we want to be supportive of them, but we also want to help them not only function in their life, but thrive. And I think that often involving their friends and family. So it's a little bit of individualized, but it's also something we really kind of push as a supportive recommendation.
Yeah, thank you. It's so important to bring that support system in as much as we can. And thank you so much for your time, Lina. We're so grateful to have you on our team.
Thanks, Rachel. Thanks everyone for joining us.
So next we have AJ Shoemaker, primary therapist for the mental health program. AJ received his MSW in 2013 from University of South Carolina. Prior to his role with Pasadena Villa, he worked primarily in the inpatient psychiatric setting with a variety of populations, but had a specific focus on mood disorders in both adult and adolescent populations. He also has experience in leading IOP group sessions and ER crisis evaluation. He's been under LCSW supervision over the last 2 years and expects to be eligible for licensure testing later this year. All right, AJ, what is the primary treatment focus of the Pasadena Villa Mental Health Program?
So I think it's something we've really touched on a lot. Really, our primary focus is that evidence-based piece. You know, I am relatively newer to the program. And what I've really been happy with seeing is it's been a lot of integration in between DBT and CBT skills. And I think we do a great job of meeting these patients where they are. You know, we're really focused on client-centered care and making sure that even though it is, you know, a group theme and modality, that they feel like it's an individualized treatment for them too. You know, we treat really a pretty broad range of diagnoses, and you know, as long as, you know, clients are able and willing to engage in therapy, you know, I think it's really easy to, you know, bring in a broader range of clients to treat and to see success in our program too.
Yeah. Thank you so much, AJ. And as AJ said, he is the newest member of our team, and he's been doing awesome so far and fits right in with us. So we're so excited to have you, AJ. Thank you.
Thank you. I appreciate it.
Yeah. So now I want to go back to the PowerPoint slides. There's a couple members of our team that weren't, I don't think they're on this Zoom. So I'd like to just point them out. There they are. So let's move this. So we have Yvonne Creighton, our psychiatric nurse practitioner who does on-site assessments. We also have our attending psychiatrist, Dr. Kelly Omby, and we have our supervising psychiatrist, Dr. Tom Scales. We also have 2 registered nurses that we weren't able to get pictures for, but we have Katrina Van Treese and Tara Fox, who help us with vitals, weights, and doing that type of thing. So that's our medical and psychiatric providers. Next, we have Ileana, our office coordinator. She's here. She's helping us with the chat, making sure we get all of our questions answered today. And also, Ileana is the face of our treatment center when it's clients' first day of programming. And really, she greets them every morning when they start their programming. So Ileana is awesome. She helps us a lot with programming. And as you see, she has a bright smile that helps to welcome everyone as they come in. And we have Dana, our director of admissions for the outpatient programs. Dana runs a small team. Her and her team are awesome, and they do whatever they can to help get people the care that they need. So we can show the next slide. So if you had questions on how to reach us or get more information or how to refer a client, our admissions line is listed there. Here's also my contact information for the Nashville area. If you have any questions, please reach out, or if I can assist in referrals. And Kayla Carson's information is also listed for outside of Nashville and throughout the Southeast for the Eating Disorder Network. So we're about to start our Q&A, but right before that, I would like to do our prize drawing. We have a $50 Amazon gift card that we are going to give away to a lucky winner. So if Rachel Slack, if you could pick someone at random and put it in the chat, we can announce that winner. Maybe. Ooh, Sarah McCormick. Congrats, you won the Amazon gift card. So we'll be sending that out after this.
Thank you.
Yeah, yay, congrats. So now I'd like to move into our Q&A session. We've got quite a bit of time. We're a little bit early, so let's get some of those questions. Ileana, if you want to help with those questions that have come in, and if you have any new questions, feel free to raise your hand or use the chat function, and we'll get those answered.
Hey, Rachel, it's Kayla. We had a question from Sarah Gossick asking about aftercare support. How do we support our clients upon discharge to ensure they're ready for aftercare?
So I'd be happy to answer that question. All of our clients, whether they're in our Selah House or our Pasadena Villa outpatient program, are set up with a discharge plan that sets them up with a dietitian if they're in need of that, a therapist, and a med provider, psychiatrist or nurse practitioner. If they need additional support, like referrals for family therapy and other support groups or DBT groups to help support them in their recovery at discharge, we assess that on a case-by-case basis. We are young in that we don't yet have an alumni program, but I do hope that we'll have the capacity in the near future to do some support groups and things like that and develop an alumni program. But for now, we work on developing a strong discharge plan and setting up clients for success and making sure they're following through after discharge and have made connections with their new providers if that's taking place.
Thank you. Let's see, what other questions have come through?
Rachel, I don't see anything in the chat, but I'd love if anyone would like to unmute their mic and ask any questions, whatever is on your mind. We're happy to go through those with you.
Wow. We can also elaborate on anything that the therapists or dietitian have said so far.
I can't remember if this was already mentioned or not, but was there like family programming or things like that included at any level of care? Sorry, my dog.
Yeah, so Lina, are you still here? Can you touch on the family piece again?
Yes, I am. So yes, we do include family therapy. I think we have some clients who are not wanting to have their family involved, but yes, family therapy is a regular part of it that we can include, including some family psychoeducation. We've done some family psychoeducation around new diagnosis, medications, as well as therapeutic interventions. We have also can include the family as part of the discharge plan, especially for stepping down and returning either to their family of origin or in helping prepare for activities such as things with holidays. So yes, we do really encourage the family to be a part of it. And that is part of where, even on the front end, as part of our crisis plan, and as well as part of the biopsychosocial, to really ask our clients who are the key people, to appreciate that none of us operate as an island or in a bubble. And so I think the more support we can give people and the more we can normalize mental health diagnosis, the better. So yes, that's a long answer to say yes.
Thank you, Lina.
Thank you.
Any other questions? Well,
Rachel, a question just came in as well, asking, what does a typical day look like for clients coming to treatment?
Robin, do you want to answer that?
Yes, I was muted. Yes, I'd be happy to. So the day looks slightly different for IOP clients versus our partial clients, but it starts similarly. Programming starts at 9 o'clock. Our eating disorder clients that need vitals taken, we'll get those done before group starts at 9. So they arrive sometime between 8:30 and 9 o'clock. Clients will have a chance to select their snacks and meal selection for the day with that check-in. And then our first group of the day it's about a 90-minute group. So it allows time for check-in and then the content for that particular group and topic for processing. Then we have a snack break and another hour-and-a-half longer group in the morning. At that time, our IOP clients leave for the day and our partial clients stay on for lunch, which we have generally a 30-minute period for lunch, and then kind of cleanup and then journaling before the group at 1 o'clock. And then the two groups in the afternoon are more the traditional 50-minute groups with a break for a snack in between. You know, programming varies depending on the day, but that's a typical schedule. And so clients may have their individual sessions with their therapist or nutritionist during that time. We do family sessions before programming or after if that needs to take place due to scheduling, and follow-up appointments with their med provider may occur during program hours or outside depending on their availability. So that's kind of a typical day in terms of the flow. The content kind of varies on the day. We usually do, you know, weekend processing on Mondays and weekend planning on Fridays. We often do an experiential group on Thursdays, but that's kind of an overview.
Thank you, Robin. And before you mute yourself, I see another question that you might be able to answer. Someone asked if our process groups will be gender specific.
No, our program is integrated with all genders.
Thank you.
And hey, Rachel, I had a quick question for you guys, and grateful to be here. Had the privilege to tour your location. It's absolutely phenomenal and phenomenal people. And you may have elaborated on this earlier, but what are you guys doing to track outcomes once you see your individual start in your process and either get throughout your treatment or continue on in other avenues? Are you guys doing anything to track their progress and things of that nature?
Great question.
Regarding tracking outcomes, yes. So we have integrated into our medical record system outcome measures tools that we encourage our clients to participate in weekly, so we can track their progress using, you know, standardized tools to measure levels of depression, for example, or, you know, eating disorder symptoms, post-traumatic stress disorder, things like that. So each client, depending on the program, will have a selection of outcome tools that they participate in and complete on a weekly basis. So we have that concrete quantitative data, as well as the qualitative data that the therapist is observing day by day, week by week.
That's phenomenal. Thank you.
Yeah.
Thank you, Robin. Thanks, Evan. I see another question here. So on the Pasadena Villa side, are we able to integrate the social model from residential into PHP IOP? And also, are there any SPMIs you're not able to work with if appropriate for PHP IOP levels?
Yeah, so I can answer that. So yes, there's a nice way that the programs, you know, the eating disorder program and our mental health program kind of integrate well with the social integration model. Part of that is kind of family style meals, and part of what we do to support our clients struggling with eating disorders is supported meals. So staff are assigned to participate in our lunches with our clients. For our eating disorder clients, that's to provide that extra support and encouragement, encourage kind of healthy social discussion and interaction. But for our behavioral health clients, that helps also in terms of taking on that social integration model and also kind of encouraging, you know, appropriate social interaction and engagement. We also, you know, as we get beyond COVID, hope to incorporate the outings aspect of the social integration model in terms of experiential activities that help clients kind of with exposure with difficult situations, kind of coping with social anxiety or other triggers. So as we're able to kind of be out and about, we're in a great location for that to get out in the community with our clients and hope to do that in the future. So in terms of severe persistent mental illness, really what, you know, in terms of criteria for being appropriate for our program, the important thing is for a client to be able to benefit and engage in group therapy. So that's really evaluated on a case-by-case basis. We're open to the psychotic disorder spectrum, but those symptoms need to be manageable. It would, you know, difficult if there's some kind of lingering symptoms that interfere with engagement in group therapy. So there's not a, you know, a black or white answer to that question. It's really case by case, and we're trying to make sure that this is the appropriate setting for that individual and we can meet their needs, and group therapy is going to be effective for them.
Thank you, Robin. And thank you, Corey, for that question.
Yeah, great question.
Rachel, we had another question come through. A clinical partner curious about our communication with outpatient providers. So they're referring a client, and what will that communication look like between our clinical team and them?
Yeah, I can answer that for the team. I think our expectation is, as long as we have a release of information, we're providing weekly, at least weekly communication with outpatient providers. We see outpatient providers as our partners in providing treatment, and we want to make sure that that relationship is strong and we're communicating well, so there's a smooth transition once we, you know, once clients, our shared clients, step down to outpatient level of care. So that's something we really value highly, and it's you know, an important component.
Thank you.
The last question I have so far, and feel free anyone to unmute if something's come to mind, but curious about the admissions process. How long can that take? As long as everybody's ready to go and ready to admit from call, first call to coming into our doors?
Yeah, I think it depends on, you know, each case is slightly different, but I think our goal overall is to complete the admission process within 5 days or less. So different factors can impact it. If there's medical clearance or questions that need to be answered, or, you know, other questions in terms of working on a financial plan, or needing to secure supportive housing in the area, you know, there's different factors, but our goal is to complete that process as quickly as possible, so clients get the treatment they need when they're ready to receive that treatment.
Yeah. Thank you, Robin. And I'll just add, if if any of our clinical partners, referring partners want to utilize Kayla and I to kind of help that communication, we're happy to do that as well. Sometimes it can be hard to reach a client, and so we can help as well. All right, any other questions? Feel free to unmute yourself. Okay. Kayla, any more on your end?
No questions. I think just for everyone to expect an attendee gift. We're so thankful that you've joined us today. And no questions, Rachel. So if you want to wrap it up, go for it.
Awesome. Well, thank you everyone again for joining us today. We can't thank you enough for taking time out of your day, and please reach out if you have any other follow-up questions or anything that needs clarification. And like Kayla said, keep a lookout in the mail for some attendee gifts for joining us today. So thank you again and have a great rest of your day.